Welcome back. Well, it is World Heart Day, which is a time to raise awareness about heart health. Cardiovascular disease, is the leading cause of adult deaths worldwide. And joining us now with more on the importance of heart health is Dr. Saema Mirza, a general and preventive cardiologist at Brookwood Baptist Health. Thanks for being with us.
Thank you for having me.
All right, so first of all, let's dive in. Obviously heart disease impacts so many people. What are some things that we can do to help prevent that cardiovascular disease?
That is actually a very good question and very important question. We can do a lot to prevent heart disease. Your lifestyle is key to prevention of heart disease. What you eat and your physical activity level. So first of all, avoiding sugars, avoiding foods that are high in saturated fat, eating a lot of healthy vegetables, lean meats, a lot of fish helps prevent heart disease. And also having a good fitness level, exercising regularly, not smoking. Those are the things you can do at your fitness level, and of course regular checkups with your doctor, making sure you get your blood pressure checked, making sure you get your sugar checked, making sure you get your cholesterol checked. Those are some of the things to begin with that you can do for your heart health.
Well, obviously both are important, exercise and eating a good balanced diet. But if you had to choose one, is there one that's better than the other?
Ooh, that's a good question. I think usually we recommend both, but I think diet goes a long way. Obviously exercise has its own benefits too. But for some reason, if somebody has a medical condition such as arthritis or some reason why they cannot exercise, then of course eating a healthy diet would take you a long way. Also maintaining a healthy weight.
And you mentioned the exercise part. It doesn't have to be something extremely strenuous, correct? It could be something as simple as walking 30 minutes a day.
That is correct. You can walk 30 minutes a day. That's what the American Heart Association recommends, at least 5 days of the week. And I tell people, even if they cannot do 30 minutes, they can do 10 minutes 3 times a day. That still counts. So that will still count as 30 minutes of the day. It doesn't have to be together. It does not have to be tennis or swimming or something extreme, or bench pressing. It can be, like you said, just light walking every day, if done right and done regularly, can have long-term benefits.
Just getting out there and moving. What are some of the most common complications that you see in your position?
Like the common diseases, heart diseases that we see.
Right.
So we see most commonly coronary artery disease, which means when your arteries get clogged up with cholesterol. And as the arterial lumen gets tighter and tighter, as the blockage gets worse, people starts to experience chest pain and other symptoms. And of course, the worst thing that people fear is a heart attack, which is when you form a blood clot and occlude the artery completely, and you starve the heart muscle of oxygen.
Yeah.
So we see that, and then atrial fibrillation is a rhythm problem that we see commonly. And then there's a bunch of other heart diseases, but congestive heart failure, when people have enlarged hearts and the heart doesn't pump forward well, and blood backs up and fluid backs up into their lungs and their legs. So congestive heart failure is also a common thing that we see.
All right. Well, we hope that everyone takes awareness of this today on Heart Health Day, and we appreciate Dr. Mirza joining us today on Now at 11. Thank you so much.
Thank you.
Well, humans are not